country meet the great challenge we face during these unprecedented times. We know this pandemic has caused major disruptions within your business, your communities, and your families. We want you to know that we are here in this together, and we will be here to continue to support you. The purpose of today's meeting is to provide you with important updates from the state, as well as share some insight from the MEP National Network. Missouri Enterprise, just to back up a bit, is the state's dedicated MEP center. And our #1 mission is to sustain manufacturing in the Show Me State. Following the statements from our esteemed guests today, including Lieutenant Governor Mike Kehoe, Jennifer Hagan-dier from the MEP Network, Michelle Hataway from the Missouri Department of Economic Development, and then our own supplier scouting lead, Dave Goebel. We will then open the forum up for questions and then hope to hear from you manufacturers on the phone about the specific needs you have to help us meet the medical supply chain gap, specifically as it relates to PPEs, as those remain the top priority for our medical personnel working day in and day out to care for the sick. We also have additional guests in attendance here to listen in and support this mission, including Homeland Security Director Kylie Dicknight and folks from our state legislative offices. Without further ado, I would like to invite Lieutenant Mike Kehoe to the phone.
Well, good morning, everyone, and thank you, Amy, for organizing this call. Missouri Enterprise certainly has been a key organization for us as we move through various programs, specifically Buy Missouri and other small business issues that we've faced since I've been in this office. And I know you guys have been in a long time, so I greatly appreciate you setting up the call, and I greatly appreciate your members' interest in this issue. You know, certainly we are in uncharted waters and challenging times like nobody has ever seen before. And I will tell you that the response from the business community across the state has been incredibly humbling for me, because I've been involved in some small projects as it relates to various PPE requests and things, and I've never had anybody say no. We have had just an outpouring of support from people who have said, how can I be involved? What can I do? And what is it that you need? And I equate it to an unfortunate circumstance we had in Jefferson City last May, almost a year ago, on May 22nd, when we had an EF3 tornado come through. We had more volunteers and more businesses, more people that wanted to help than we really knew how to utilize them, you know, because everybody wanted to go, 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 and we had to try to kind of put them in order of how we needed them and where we needed the crews and what we needed to happen first and second, et cetera. And we're in a similar but much larger situation right now with the Covid-19 crisis. So the issue, and Michelle is going to talk about this from our Department of Economic Development. She's is a rock star for our economic development team, and I'm glad we have her on the call. But the issue that we're trying to get our arms around is PPEs. And so personal protective equipment is something that you're probably seeing a lot of on the news, where frontline medical workers, EMS providers, police and fire folks want them. Nursing home people are looking for them. About anybody who interacts with the general public is, you know, they believe they need PPE equipment. And I said the word believe because most of everybody I said does need some PPE equipment, but the word believe because they need various types. Some need face shields and masks. Some need just the mask and no face shield. Some need gloves and gowns, some don't. So it just depends on which one of those particular job classifications I went through on what they need. We have had several manufacturers reach out to us in the last week that are what I would call more along the line of sew facilities. We have a huge one in Bourbon, Missouri, that Paramount Manufacturing that has been working with a couple of our folks over at the State Emergency Management Agency. You'll hear us say SEMA, State Emergency Management Agency, to see if we can come up with a cloth respirator that meets CDC guidelines that also is in need. Because our biggest fear is that we have a bunch of people jump in and start making stuff because they say, I can make face shields, I can make cloth this, I can make gowns, and then we don't have the need for them, and we end up with a warehouse full of that product on shelves. So part of what we're hoping and asking DED to do along with SEMA is to take the lead in coordinating what is our need, do we have a way to distribute it, and then who are the manufacturers out in the state who are willing to take that need on. I can tell you that I have a relationship with somebody for over 30 years whose family is in the custom molded parts business up in Minnesota. 2 weeks ago, they make parts for snowmobiles basically and a lot of farm implement equipment. They're a one-off company, so when you need 100 of something, you call them. They don't do 10,000 of anything. They're ready to lay off their 90 employees, and they all of a sudden said, hey, we can take some of our equipment here and we can make face shields. And they were able to acquire the plastic, the foam, the strap that goes around your head. Within just about 2 weeks, I think they've made over 2 million of them, and they have orders for 8 million. So we need people that are willing to think outside the box, that wants to work with our supply network to make sure if, for instance, somebody said, I want to make face shields, we had the need for it, and then we had the way to distribute them out to those frontline workers. Just as an update on the COVID-19, as you see, if you're paying attention, Missouri's numbers continue to go up. We have many counties that don't have a case. We have many counties that just have one case. However, as most people will tell you, if you're looking for and waiting for the statistic to hit the piece of paper or your spreadsheet, you're probably behind the curve. So trying to get in front of this is very important to the governor and I, working with local communities, working with mayors, working with school districts, trying to find out what it is we need to get in front of. And most of the medical experts, which I am certainly not one of, believe that Missouri's peak is still 2 or 3 weeks away. So when we talk about making PPEs, are somebody interested in helping us with that? Timing is very important right now. We, unfortunately, and I know in the manufacturing business, in my limited knowledge of it, sometimes things take weeks and months to plan and design and go. We're going to need folks who are interested in helping us in key areas that have the flexibility and the creativeness to, convert whatever it is they're doing now over to something that we need in, days, in a week, not months. So it's a challenge for the people on this call, and I completely understand it. It might not work for everybody, by the way. So doing what you think works best for your business, for your employees, for your location, obviously is also very important to us to make sure that you do that. And last but not least, I would just touch on the kind of the white elephant in the room. Everybody and their brother sees on the news about governors ordering, kind of a statewide stay-at-home order. I think Governor Parson is looking at the data and trying to look at the anticipated data, along with Dr. Williams from our Department of Health, as I mentioned earlier, trying to anticipate where some of these numbers are coming from. That's a huge step that the governor feels as a conservative, that all of a sudden government starts telling him and picking businesses that are winners and losers. However, the other side of that coin is the pressure on our healthcare system is something significant that we have to consider. As you know, a lot of our rural counties don't have or have very limited access to a healthcare facility. Therefore, if people start getting these cases that are severe and require hospitalization, it's going to put incredible pressure on the Columbias, the Kansas Cities, the St. Louis, and the Springfields of our state. So it's a balancing act that the governor, I can tell you, spends every waking hour of the day, which is a lot of hours these days, trying to make sure he's doing the best thing for Missourians and the best things for Missouri's economy, so that we don't use one to cripple the other. And it's something that every day and every hour he'll be assessing along with his team to see what the right answer is from Missouri to go forward. So it's something he's looking at. I just want to make sure everybody knows that it's not something, if you listen to the media, unfortunately, it seems like the governor and his administration are taking this lightly, and I can guarantee you that is not the case at all. So with having said that, I've spoken enough. I can't tell you how much I appreciate the people being on the call, Missouri Enterprise for organizing the call, DED for helping us out, and we also have great folks from SEMA on the call, as well as State Emergency Management. So I will turn it back over to you guys and let the experts tell you where we're at. So thank you very much, and stay safe, everyone.
Lieutenant Governor, thank you so much for your leadership. Thank you for carving out some time. I know you're very busy at this moment, as you just mentioned, and thank you to our governor for his leadership. We really appreciate the support and hope to continue this relationship and further supporting the manufacturing community. Thank you. And I believe you're going to stay on and listen in, so thank you for that. And now we'll go ahead and kick it over to Jennifer Hagan-dier with the NIST MEP National Network. Jennifer?
Hi, good morning. Yeah, hi, good morning. Thank you all for being on the call again.
Oop.
Definitely in unprecedented times. Can you hear me?
Yep, we just missed you for a minute, but
okay.
Go right ahead.
Minute, yeah, it detected a feedback loop, so I was just making sure. So I am currently, just a little quick background, I'm based in Nashville, Tennessee. I work across all 50 states in Puerto Rico. I work with the MEP National Network, which Missouri Enterprise is one of our MEP centers, the MEP Center for Missouri. We have a center in every state, and each of those centers does similar to what Missouri does for their manufacturing industry. And part of the beauty of our network, especially in times like this, right now, is that COVID-19, just like supply chains, don't know the difference in state boundaries. So although you guys have to focus on what you need for your state right now, and rightfully so, there are folks like myself and others that are looking out for how we can help connect you to the things that you need. Because if you're a manufacturer and you have a need for something that's not being made in Missouri, we need to be able to locate it somewhere else in the country. So we have been tracking the trends, and again, I work hand in hand with the NIST MEP folks that run the Department of Commerce. So as you can imagine, it's changed daily and hourly on some days. Our first few weeks were really about making sure that the MEP centers could keep their doors open and convert all of our hardworking folks to helping manufacturers when we work from home and get into the plant. How do we help you? So we focused on that first, and now pivot to making sure that the manufacturers can do what they need to do to supply the medical needs. And we have to look at that from several places. One is cash flow and financing for manufacturers, right? That's a huge piece because lots of folks want to help. Lots of folks want to do something, but you still have to keep your doors open and be able to pay your people. And so where we have seen a lot of struggle across the country, this is not isolated to any one area, is the need for purchase orders and some cash flow and loosening up some of that liquidity to be able to purchase equipment or goods or things you do need to make something that's different. And like the Lieutenant Governor said, thinking outside the box, we have a lot of creative, amazing people around this country and in Missouri that are willing to help and want to help, just need help figuring out how to do that. So that's where Missouri Enterprise comes in, as well as it sounds like you've got an amazing team there. Every state is handling this a little bit differently. So I will commend you guys for doing this call, because it's something that I think folks need to feel like they're all in this together, which we are. One of the big challenges we're also seeing is liability associated with manufacturing devices and PPE. So the question of, if I were to pivot or if I was to do something different, what are the qualifications? What kind of specs do I need? These are challenges we're seeing across the country. How do I have to quality test? What is the testing protocol? So we're working hard, both from a statewide basis as well as a federal and national basis, to figure out these things for you guys so that you have that information and can go forward. We can't let perfect get in the way of progress, especially in times like this. So we're working on the federal side to put together portfolios of different services. Like a FEMA has a how to help page. And I have all these resources. We'll make sure that Amy has those and she can get them to you. MEP, again, is posting what we can, but Enterprise Missouri would be your place to go. And then, connecting resource to need, again, I think from manufacturer to manufacturer is one piece, and that's what we do really well. The other piece, though, is critical needs to hospitals. So what we're finding across the country, like I use the example of South Carolina, was we've got a manufacturer who can make the masks, but we've got hospitals who are leery of buying without an intermediary because they're afraid of scams, also of getting things that aren't up to par. So when you're making masks just for general public use, that's different than if you're making something for someone who's on the front lines. and the desperate need we're hearing from like Tennessee. Yesterday, I heard they need 200,000 masks for ER doctors across the country. This is not just in Tennessee. And where do we get those? And so that is a struggle that we're seeing everywhere. Mapping the supply chain, we now realize we don't know who does what everywhere. And some states have a better handle on it than others, but across the country, we don't have that information. And we're also needing to determine, as the Lieutenant Governor said, demand. What does that demand look like? And how do we project? And we are in unknown place. We don't know if April, we hope that's where our peak we'll see in most states, but we may have a second wave. And how do we balance that need and acquire the materials to make the products? And then one thing the MEP centers can help with is all of those things, right? In addition to assisting in skilling workforce and testing equipment and helping you to determine what you need to do to make those changes. So I think from an MEP perspective, right now we're in the business of helping manufacturers, number one, stay in business, and number two, do what they need to do for these times. And some of that might be hunkering down and helping with keeping their families safe, right? Making our communities safer. So we're working across states and as best we can across federal agencies, and things change very rapidly. But you do have the power of the network behind you here for Missouri and for everyone in the state of Missouri. We can look at New Jersey, we can look at New York, we can look in California. We can pull from those states who've been doing this for a couple months longer, weeks longer than most of us. And they've had to deal with some pieces that we can benefit from learning from that. So that's where we are. That's my job every day, all day long, in addition to the 4- and 8-year-old that may run through the house, and I apologize for that in advance. But we're all balancing a new normal. And really, again, thank you for all that you're doing. And then I know that you have experts on this call who could talk more specifics about kind of how you guys can do this for your own state. Amy?
Thank you so much, Jennifer. Incredible insight, and cannot thank you enough for everything that you're doing for our country, the leadership that you're giving to our state and insight. It's so helpful right now, and we're just gracious for you taking some time off your busy day to join us and give us that update. So we really appreciate it. And if at any time, Jennifer, you need to hop off, we respect your time and thank you again. Now I'd like to open it up to Michelle Hataway. Again, she's really championing this medical supply chain gap, informing manufacturers, connecting the dots here with Missouri Department of Economic Development. So with that, Michelle, would you like to join us?
Yeah, perfect.
Great.
Good morning, everybody. I'm Michelle Hataway. I'm the Central Regional Manager for the Missouri Department of Economic Development. I want to start today by educating you on that PPE demand. We've heard Jennifer and Lieutenant Governor Kehoe talk about that demand piece. So earlier this week, we did a call with BJC, Cox Health, Mercy, SSM Health, and St. Luke's, the biggest players in the healthcare sector in Missouri, and we talked to them about the future demand and the type of modeling they were looking at to predict that future PPE need. Some were looking at predictions of sick patients, others were looking at how many workers they wanted to protect. They all agreed that right now they are in PPE conservation mode. So they were asking their staff to be as conservative as possible because they know that we aren't even into the peak of this epidemic. Through the help of our partners at the state, we've engaged with over 130 hospitals and gathered what they predicted their demand to be in the next 30 days. This is just 30 days out. So as you know, there are plans for this to last a lot longer than 30 days. For the next 30 days, SEMA and hospitals around the state will need around 5 million surgical masks, 3 million face shields, 2 million N95 masks, 7 million surgical masks, and 22 million pairs of gloves. Some of this will come from traditional suppliers that they already have in their networks. However, as you know, these hospitals are competing with other countries and other states for these supplies. This is why we believe it's important for Missouri manufacturers to help step in and produce the necessary PPEs. Last week, we put out a call for companies that were interested in helping with the state's PPE shortage. Over 250 companies responded. We were overwhelmed with the support from Missouri businesses. And I know several of you responded to that request, and we thank you for your willingness to help. Each business is at a different stage of the process, And our goal at DED is to connect the available PPE to the people who need it. While we do have some information from the FDA and some specs for certain pieces of it, and just this morning, the ASTM International, who is formerly known as the American Society for Testing and Material, they set standards for PPE equipment. Just this morning, they released their standards free of charge for businesses so that they can help pivot operations to producing hand sanitizer, masks, face shields, gowns, and some other PPE equipment. We will make sure that Amy has all of this information after this call so she can share it with you guys. But ultimately, we're going to rely on businesses and their entrepreneurial attitudes to be successful in this epidemic. This is what businesses do best, is coming up with solutions to problems. Unfortunately, we don't have the time or resources to walk all 250 companies through the FDA process and sourcing of raw materials. Our healthcare industry doesn't have time for us to do that. But there are partners like Missouri Enterprise who do have the expertise and time to support you. Missouri Enterprise can assist with work changes, facility setup and flow, and use their supplier scouting program to match your company with materials and other suppliers. Every week we will be getting demand from hospitals, and we'll be communicating that demand to interested manufacturers. Then DED will market the available PPE to hospitals that need to purchase it. Again, our role is to connect the available PPE to the hospitals and frontline staff that need it. When companies have started to produce the PPE, they can let us know by going to ded.mo.gov/how-to-help. There'll be a button on there that you can click Ready to Sell. On that site, they will tell us what they're making, the quantity, price, and delivery date. And again, every week we will communicate a list of that available PPE to the hospitals. Yesterday, we sent our first list. We sent almost 100 businesses who have available PPE to over 90 hospitals and SEMA across the state. The list was a combination of manufacturers that have retooled to make PPE and suppliers that have connections to PPE. And last night, I received a thank you from a hospital who was needing to purchase 50,000 to 100,000 N95 masks immediately. Because of our efforts and the extraordinary work of the business community, we're able to connect the available PPE to the hospital that need it. And this will save lives. Given what we know the need to be, we would encourage you to start producing whatever PPE you can. Hospitals have told us that there's such a demand that companies can't make enough. And Amy, I'll turn it back over to you to kind of talk through how you guys can help and the sourcing of that material.
Thank you, Michelle. That's incredible information. Again, I know Michelle said that she's going to share that with me, and I'll make sure everyone on this phone call gets that information. I just want to thank you, Michelle, for being so available. And I know you're getting inundated, as you just stated, with so much information and the overwhelming response from Missouri manufacturers that are wanting to step up and do the right thing. But thank you for keeping us all on track, and we really appreciate the constant communication. At this point, I'd love to turn it over to Dave Goebel. He's our supplier scouting lead, and that's part of the program that Jennifer Hagan-dier was sharing. He wants to provide an overview on how that works, as well as some additional information on the specific assistance that we can provide. Dave?
Okay, thank you. Good morning. I wanted to emphasize what Lieutenant Governor Kehoe mentioned is it's absolutely necessary that we start with the need. We, like so many people, have been overwhelmed with the response by folks around the state, manufacturers who want to convert their production capabilities over to PPE production, for example. But the problem is we're coming up with a solution before we know exactly what the problem is. And so, again, it's really critical that we start with the need, and I think you'll see that in my presentation. So I'll move along here. Let's say this supplier scouting program that we're engaged in is one of the 51 centers around the country that are also working to help as best we can. Those are the centers located in all 50 states plus Puerto Rico. But the way that this supplier scouting program works is, let's say that a hospital needs surgical gloves, okay? So there the need is determined. And again, I can't emphasize enough how important it is to know exactly what we need, because again, if we're kind of all dressed up and know where to go with capabilities, it's a wonderful thought, but it doesn't really accomplish the goal. So once that need is determined, we'd appreciate it if you could communicate that to us. We would submit then the request to the supplier scouting program. There's a formal channel of information, and we'll go through all that. But there's a methodology of putting that into the system so that everyone around the country can see the need and help define the solution in the way of suppliers. Then information, once that supplier is identified, it's communicated back to us and then on to the client. Okay. Now, the information that we require is an item designation or description, just a brief description of the application. Now, in most cases, if it's surgical gloves or something like that, it's pretty obvious, but we'll put something down there. Item class and size, item materials and likely manufacturing processes. Really, the materials are the key thing there. And then summary of any technical specs or performance requirements. Now, most of these things, if you're dealing with a hospital who has a specific need, they're going to know all of this, or a clinic, because they have to have specs with which to order these items. So this shouldn't be hard to come by. And then along with that technical information, we have certain business information we require. What's the annual volume in units, the target price or cost information, delivery requirements, and certification requirements. If there's anything specific about certain certifications or requirements that these garments might have to meet or these products might have to meet, because it's certainly not limited to PPE. This could be for anything. We'd want to know that. And that's really it. I mean, it's a fairly simple, straightforward program. I encourage you to take down my contact information. I am the point of contact for the state of Missouri, for Missouri Enterprise. So there are my phone numbers and email address, phone number, I should say, and email address. And we have been overwhelmed by the response, again, from people who have tremendous capability and willingness to help. But we really need to know those specific needs so that we can start to get people aligned, the people that have the capabilities with those needs. So that's all I have. I'll drop it back off to Amy.
Thank you, Dave. And at this time, we'd love to welcome Lieutenant Governor Mike Kehoe back. He has a few more comments to make.
Thank you so much. I'll be brief. I just wanted to make sure the members on this call knew that they should be watching the SBA program that is part of the Federal CARES Act that was passed last week. I was on a call with Kansas City Region SBA coordinator yesterday, as well as the Missouri Bankers Association. This is an incredible program for the people on this call that might need to take advantage of that. Obviously, it's probably not for everybody, but there's some people on this call I just felt it was worthwhile mentioning. Our state treasurer's office, Scott Fitzpatrick, will have more details on it. I think the program actually goes live tomorrow, but there's all kinds of information on the internet under the SBA and our U.S. Treasury website, as well as you'll see information coming from our Lieutenant Governor's office, as well as the state treasurer's office, Scott Fitzpatrick. So I would encourage those of you who, I'm a small business guy at heart. I'm actually a much better businessman most days than a politician, but I know what it's like to face payroll challenges, face banknotes, face the challenges that up and down business and in the economy can do to somebody. And certainly this is a challenging time that will present a lot of challenging situations for a lot of family-owned businesses and a lot of corporate businesses as well. So I would encourage you to pay attention and to check out the SBA's information. The U.S. Treasury also has on their website, or starting tomorrow, I believe Treasurer Fitzpatrick will have things out there for resources that are available to you under the CARES Act that might help you get through these times. So thank you so much, and I look forward to hearing what's on everybody's mind.
Thank you for that. Absolutely important information. Again, my husband's a small business owner, and I guarantee that we'll be there tomorrow applying for that. So great resource and to help us weather this storm. Thank you for that, Lieutenant Governor. It's also important to, as we've all said, really harness the entrepreneurial spirit. That's what manufacturers do. A lot of our companies, they create products to meet a need. That's what they do best. whether it's made in their garage or basement or on a napkin, this is the time to get creative. So even if we haven't necessarily discussed the need for ventilators or gloves or sanitizers, hospital beds, this outpouring of ideas, please continue to connect with your local medical community or labs or physicians to see what they need and how you can get creative, because this storm could change directions and we just don't know, but we want to be able to answer that call. So in addition to the scouting program that Dave just provided, Missouri Enterprise is working with, of course, the state and other organizations to identify additional supply needs that I was just discussing, who may or may not need the medical grade equipment necessarily. But again, once needs are determined, we'll certainly let this group know. One other piece of news to share, I know Lieutenant Governor Kehoe was just mentioning the CARES Act, but it also includes an additional $50 million in funding for the MEP National Network. Again, Missouri is the MEP center here for the Show Me State. And we want to let you know that we absolutely plan to apply for some of that funding so that we can help manufacturers retool, change pace, change operations to help meet this need. So we'll keep you updated on how that works. Our priority collectively for everyone on this call is to save lives, of course, by protecting those on the front lines and working with our manufacturing community to produce the much needed medical supplies. Our second priority, of course, is to connect our manufacturers with one another to understand capacities, resources needed, orders in the queue, and anything else that would be relevant to this group. So I know this has been said again, but we really need to see one another as being part of one team rather than as competitors. We need all hands on deck to overcome and meet this challenge. At this time, we'd love to, I'm gonna go ahead and unmute all. So before I do that, please make sure you have your dogs and cat noises to a minimum so that we can hear one another. And so we'd love to open it up for questions as well as any insight on any direct needs that you as a manufacturer have to help meet this medical challenge. So here we go.
My name is Jerry Nichols, president of two companies. We're both manufacturing companies, and one actually manufactures filters. And we obviously go and work with material all the time in that way. We have one facility we already another 15,000 foot facility idle at the moment. So my question is to answer.
I got the one email address. I've got Amy's in my email. Okay.
Just a reminder, I did unmute all those participants on the call. So if you are not asking a question or providing input, just go ahead and unmute or go ahead and mute yourself. And when you are ready to ask a question, then you can unmute it. Continue on, please.
Did you hear anything?
We did towards the end of that. There was some overlapping.
So we already have a filtration company, and we manufacture and sew material all the time. And we have a 15,000 square foot idle facility right now because of what's going on. My question is, how do we get material information and patterns so we can answer the question specifically?
Michelle, did you want to answer that, Jennifer, or?
Yeah, sorry, I didn't hear the beginning of it. So we do have some specs that I can share with Amy. It's from the American Hospital Association, and really it's just a network of hospitals around the area that are using specs around the country, really. So we can provide some of that, and it does have details depending on what you're wanting to make. Face shields are on there, surgical gowns are on there, and then the specs and requirements and the material.
We would be gowns.
Okay, perfect. So I can share that with Amy, and she can share it. Now, I think you're going to want to partner with Missouri Enterprise on sourcing the raw material, and you'll want to make sure that it's the correct level of sterilization. So I believe the gowns are what are known as a level 2. But we can provide all of that to Amy, and she can follow up and kind of help you with that.
Okay, great.
That's great, thank you.
One bit of advice too is what we found is there are so many different specs, and that's a great source right there that you've gotten. There are open sources, there are all kinds of things. Is one thing that Missouri Enterprise may be able to help you with, that I know it's happening in other states, is being an intermediary between you and the hospitals, so that if you identify the primary places you would be supplying these, that to ensure that their specs are what you're going to be doing. So you're not going down a road to manufacture something that they may not find useful, right? So and Amy, I can hook you up. Vermont is actually setting up a way to do this with their governor's office around how to procure. So the governor's office could also do procurement and then disbursement out to the health facilities.
Okay, thanks.
Great, thank you.
Hi, this is Rachel Hankerson with International Proof Systems. I have a question.
Hi, Rachel.
Hi. This question is in regards to the presentation from Jennifer Hagan and Michelle Hataway. I believe Jennifer stated that there is a need for 200,000 masks for ER doctors across the country. And Michelle presented quantities in the millions of masks, gowns, and other things as well. Now, the specs with the ER mask, are those specs the same as the specs for other masks within the healthcare facility?
That is something, like, I will let someone else answer that question, because I believe this is a challenge we have been facing across all areas. Is because this virus is new, it is something that we have never seen before. What you would say is specs. Right now, they're saying anything is better than nothing, right? But the ER doctors, frontline responders, need a certain type of mask, and it requires a certain type of material. And that is because of the size of the micron, and I'm not an engineer or a scientist, but the size of this virus and the ways that it can be spread. So depending on how that mask is going to be used, you almost need gradations, right? There would be, if you're just somebody coming into the ER, it's different than if you're someone working in the ER versus being a surgeon. So there are different levels of the microns and the way that the material and how they have to be constructed. That's the extent of my knowledge. We're working to get that information and continue to clarify that.
Perfect. Two more things and I'll be done. I believe Michelle made mention of certain hospitals feel more comfortable with receiving supplies from, I guess, certain vendors. Now, and of which I totally understand and agree, especially considering all of what's going on. So my question is, with different manufacturers coming on board, is it at all possible to send all of our produce or our production to a department or quality assurance department just to ensure that everything is of par before we distribute to the various hospitals, rather than, each new manufacturer sending directly to the vendor, being the hospital? So again, my question is, can we who are new vendors, manufacturers, send it to a quality assurance area for the quality assurance team, make sure that each mask is as it should be, each gown is as it should be, each glove, before we disperse to the various hospitals that are in need? And then when you ask that, should I go ahead and get my third one so that you can just answer everything together, or is that too much information right now?
I think I took a note down so we can make sure we're tracking all your questions.
Okay, so third, the Lieutenant Governor gave a great statement in regards to surplus. So we want to make sure that our demand meets our supply meets our demand. And he made mention that, we don't want to have all these manufacturers make all these units and there's no need. So my question kind of goes back to what Jennifer was stating. Considering there's still a need across the country, I believe my research yesterday showed 22,000 new cases as of yesterday throughout the country. Is it possible, if we meet a surplus, rather than having them stored in our Missouri storage area, is it possible to send our surplus to other vendors in need across the country?
Those are excellent questions. Oh, go right ahead.
Oh, that's it. Those are my questions.
Okay. Jennifer, I would pose at least the first one to you as far as what if you're seeing any sort of quality control facility or center entity that is ensuring that it's meeting those medical grade needs for the folks that are on the first line. Are you seeing that elsewhere?
So
and then,
no, not at this point.
Okay.
But it's a great idea. And what we are seeing is, again, and everyone's trying to do this differently, is a clearinghouse of, so like in California, the MEP program serves as a clearinghouse for manufacturers around information, and that's the detail, not the actual material. But then in Vermont, what you have again is the state government procuring, right? So the specs are sent out, the information, the quality, all of these things are provided, agreed upon, and then the manufacturers are manufacturing. The procurement comes through the government, and then it is dispersed from there. So that is one of the ways, rather than, like you said, ad hocing to different hospitals and having a clearinghouse. It's a great idea, and would be a great model if we could figure out, again, some states, and I'm sure it's not in your case here, some states are challenged with the procurement piece, right? So there's liabilities, there's challenges around, and then there are some liability waivers in situations like this, especially if it comes through the government side. But then I can't speak for the state government, but there are also procurement limitations. So there's a host of pieces that fall into kind of how you do this. And then quality control, again, that's what we're working on right now for a lot of states, is nailing down, if I make a ventilator, let's talk about ventilators, because that's really the one that's the highest need in terms of saving people's lives. If I'm making a ventilator, do I have to test every part, every fifth part? How does my machinery need to be tested? So there's a bunch of those pieces too that, and then Alaska, the state government of Alaska just passed a bill that basically indemnifies manufacturers who are working in good faith to provide critical needs during this time period. So that kind of alleviates some of that challenge for some of the small manufacturers. So there's not, I don't know if it's an answer, but that's kind of, yes, it's a great model, but each state's individual procurement process and how that works and liabilities all play into it. Right.
Hey, Amy.
Yes.
One thing I wanted to mention, that you and I talked about this yesterday. I spoke with Dr. Ramsey at Missouri S&T.
I was going to ask you to provide some insight on that. Yes, or mention that example.
What they're doing, they're making face shields for a hospital in Rolla, Missouri, and so because the supply chain is so strained and the materials are so scarce right now, that they are having to find alternative materials. Consequently, they're labeling the product, and I'm trying to get a copy of the label, but it's something to the effect of not for hospital use or not for medical use. And then, and this is by agreement with the hospital or the clinic or, the fire protection district or whoever they're supplying to. And then it's up to that entity to determine the level of protection they're looking for, because.
And the entity being the hospital itself, correct?
Yeah.
Not.
Right, letting them determine, because, for example, my research showed that with gowns, there are 4 levels of protection that they look for. One would just be in addressing, a patient, just walking in and talking to them, for example. One would be when they're drawing blood, obviously a little more critical. Another one would be, there's another level of drawing blood. It's a bit more severe, but that's a level 3, and then a level 4 might be a full-blown surgery. So, but a basic mask or gown, the goal is really just to protect the wearer from droplets of bodily fluids from the patient or vice versa. So it's not, most masks, other than an N95 mask, are not going to protect you from the coronavirus because, as Jennifer mentioned, the size of the particles that, basically the germs that float around are so small that they have to have really, precise filtration to keep those out. So it's an alternative, and I'm not suggesting that everybody just go hog wild and say, well, I'm just going to label all my stuff. I'm going to do a little more research on that and find out what the particulars are. But I think that's the way around some of this, because I'm afraid that even with the best intentions of folks pivoting to create all these products, that they're not going to be able to get the materials anyway because the big users are taking all those up. From what I understand, there are a waiting list for some materials, and I don't have the details on which materials and which markets, but we'll research that a little further today, and then hopefully share some more information with everybody. And again, that may be a way around, and perhaps the state can consider, some kind of a disclaimer or something, again, acting in good faith, type of thing, so that we protect people who are trying to do the right thing for the right reasons. But again, like Jennifer, I have no have nothing to do with the state government and no pull there, certainly. So, but perhaps Lieutenant Governor Kehoe can help us with that. So anyway, that's my piece. So I'll turn it back to Amy.
Great. Again, the floor is open. So if there's any other questions that you all have.
Hi, this is Lisa Williams. The question I have is they're building pop-up hospital facilities around every major community for the overflow with where the hospitals cannot handle. There will be other building material things, for instance, wall plates needed to hook up the ventilators or other type of peripheral goods. Is any of that coming through all of you, or is that all done at the local level?
Amy, I can jump on that.
Great. I was just asking if you were muted. Go ahead.
Yeah, so again, Michelle Hataway with DED. We are helping assist with that at the department. We have a team. I'm not included on it because I'm focusing on this PPE effort, but you can send any of the any supplies you would like to help or for us to procure through that to Amy, and we'll get it to that appropriate team. I know they are, there's some other state agencies that are helping out in the building of those things. And we have had a lot of people reach out to volunteer, generators, tents, stuff like that from their supplies. So I don't know where the need is, but if you're interested and would like to be put on the list to be reached out for that, if they do have that need for what you're specifically offering, send it to Amy and we'll make sure that our department gets it.
Great, thank you.
Thanks for your question.
Hey, this is John Phillips with Southwest Technologies.
Hi, John.
We're a med device manufacturer, and we have the ability to make gowns and hand sanitizers. Currently, though, we would need specifications for the gowns, and we need raw materials to be able to make hand sanitizer, and those seem obviously to be in big demand, short supply. Is there anything that anybody we can tap into to possibly source some of those materials and specifications?
Dave?
We're not really getting involved in the supply chain so much. We're kind of a broker trying to align people capabilities with needs. I'll try to do what I can to learn a little more about that, but that's not something that we typically do. We're not really tied into those supply chains, so to speak. So I'll see what we can do. This is every minute something new is developing, and so that's something that we obviously need to look into, and we'll certainly take that on.
And as far as the specs, that is something that we plan to share following this call.
Okay, thank you.
Yep.
And to that point, we're working to get a national way to source this types of questions. So it's right now, I'm sorry, it is still it is ad hoc, but that's what we have to do right now. So that kind of request can be pushed through our network to see if we can find someone that can do that.
I think that goes back to your clearinghouse, and that this is certainly highlighting the need for that system.
This is John Hickson, but if someone has access to all the businesses in the state by NAICS code, you might be able to narrow down that search a little bit. Maybe you guys have already talked about that.
We can get that information. So we do have ability to pull that information specifically for Enterprise for Missouri and get that to you guys, to Missouri Enterprise.
Great comment, John.
Yeah, this is Rachel Hankers, and again, I apologize for asking so many questions, but definitely want to make sure that
not at all, Rachel. Thank you.
Deliver. Now, with the supply or the supply of materials being low here in Missouri and across the country, with reference to the U.S. numbers being the highest with the case of COVID-19, is it possible to communicate with our allies or, other countries with lower numbers to bring in or import some of their materials so that we can keep that timing, expedited? Is it possible to do the export-import trade communication to bring in other?
We actually have I believe, Michelle, correct me if I'm wrong, we have some folks from our international team with the Missouri Department of Economic Development, I believe, are on the line. Michelle, is that right?
Amber Dallas couldn't join, but they have been reaching out to their connections. You were correct, Amy. Our international team has several offices across the world, and when we started this last week, we started reaching out with those offices first to see where we could get those connections to the supplies that was currently already being made. And we're very, very fortunate that did lead to a lot of results in early leads for us to be able to import in some of that stuff. And I was going to say, with your question earlier, Rachel, I think you asked it, with if we have an overflow of stuff, they can also help us export. So
great.
Again, we don't want it sitting in a warehouse, but if there are other, if the need is for other countries or for us to have it, we have those relationships in order to import and export in order to be successful with that.
Perfect. Thank you.
I would offer another observation. One of our RAMP roster members, Dave Peel at A to Z Castings, has an extensive network of global partners, and he's been coordinating through the Missouri Hospital Association to try to get the supplies that he can get into the network, into the system, to places that actually need them and want them. So Missouri Hospital Association, if you haven't talked about that yet, is kind of a consolidated organization that of all of the hospitals in the state.
Hello, this is David Peel. Can you hear me?
Yes. Good morning, David.
Yes. Good morning.
Your nose was itching.
Hey, I'd like to jump in there, and thank you for bringing that up. Hey, I want to throw this out. I'm a small business owner in Lincoln County, Missouri. I have extensive background in export and import. I have people in China that are working with me now to import KN95 masks and N95 masks. I have access to gowns. I have access to hand sanitizer. I have access to now ventilator production. Everything is FDA approved and also the European standard. I've checked all the FDA registrations for these manufacturers, and they all check out good. My wife and I have invested literally thousands of dollars importing this product in, because there is a sense of mistrust. There's so many people out there right now trying to scam everybody. I don't want to be involved in that. So we invested the money and we are bringing the product in. I can't do that forever, because now the quantities have increased so dramatically. It's beyond my financing. But the products are scheduled to start arriving tomorrow. I'm bringing in hospital masks. I'm bringing in N95 masks. I'm bringing in KN95 masks. I have approximately 12,000 masks on their way now. But like I said, this has grown far more than I can possibly finance. But again, I have extensive. I've been doing this for a long time, and the people that I deal with, they're like family. So I'm not just throwing this out saying that I can do it and go on Alibaba and buy it, but I'm buying this from trusted people. So if there's anybody that can help me, or if I can help anyone, John knows me well, and it'd be easier for him to just give you my contact information, but I am available.
Thank you, David. And that is an excellent idea. It's something that we were mulling around with Lieutenant Governor's office, which is to create some kind of live dynamic document with those folks on the phone and folks that do want to help out and may or may not be ready to be part of that pipeline yet to develop the medical grade PPEs or whatnot. But how can we kind of keep this community engaged and have status updates and be able to share one another's contact information? So excellent idea, and that's something I plan to follow up with, is to have that live Google Doc with information.
Okay.
So Amy, can you hear me?
Yes. Who? It's a little faint.
Key. This is Janice Key. I'm with International Proof Systems.
Hi, Janice.
And I have a question. Hi. I just wanted to recap. So where do we get the supplies from, and also the patterns? How does this work again? I just wanted to do a recap on how do we get started.
Anyone want to jump in on there?
But when we're looking into that, I think that ASTM information is probably going to be the best. I've been doing some web searches, and there are tons of patterns out there for things like gowns, but you know, you're going to have to check with the individual hospital or clinic to be sure that, you know, that you don't come up with something that's too far off. I don't think they're going to hold you to. And I guess it's just a guess. Given the shortages, I would say that anything that's going to function closely to the real thing is probably going to be acceptable. But I can't say that for sure. That's just kind of a common sense thought. I hope, maybe not. Let's see what we can find out. If ASTM has the information, I don't know if they have the patterns. And I know that there are some companies. One company we were in discussion with yesterday had reverse engineered masks. They basically got hold of some masks, they took them apart, and then you know, made drawings of the different components and how they were assembled, and then created their production process from that. So we may have to do some of that. I don't know.
Okay, thank you.
Yeah, just have to find out. But sorry about that. I wish I had more to share with you.
And again, I think this Google Doc with information sharing, so you can easily see on this list, someone is blueprinting, or excuse me, is 3D printing this medical grade materials that you could then use to sew a surgical gown, right? So I think that this is going to be another great way to connect this community. All right, it is a minute shy of 10 a.m. If there's time for one other question, we go ahead and open the floor. But other than that, I think we're gonna be respectful of everyone's time. One last question. Okay.
Amy, this is John Hickson. I have a question, and
yes.
Again, maybe you covered this earlier. I couldn't get into the meeting.
Sorry.
Late. Do you plan to reconvene on some basis so we can kind of have a string going of how we can plug in here?
We do. And that's something we're gonna kind of deliberate over after this, is how to keep this community engaged so that the Rachels and David Peels of the world and everyone else that chimed in can talk to one another and share best practices, provide status updates, and then hopefully we kind of flow that communication as well that we're getting from the national and state level. One other thing, John, so excellent way to kind of conclude today's call. The state is also planning to hold an update meeting tomorrow from 3:30 to 4:30 p.m. for manufacturers, again, interested in kind of being part of that state list that will go directly to the hospital system, where it's their discretion to figure out exactly what they need and who they're going to work with. So we invite you to that. Again, I'll make sure that's in the follow-up email that I send to you all with direct link to DED's invitation. We also invite you all to attend a teleconference that we're having at 4 p.m. today if you're interested. It is a follow-up meeting on infectious disease planning guidance for manufacturers as it relates specifically to ensuring that their employees remain safe and their products are safe. Manufacturing is one of the top industries in the Show Me State. We make a lot of goods in that we ship to neighboring states throughout the country and around the world. So what can we do to ensure that those products remain safe? And if someone is infected, what are the steps to take? If you are interested in joining, being a part of that, it's a teleconference. It'll be very similar to this setup that is at 4 p.m. today. Let me know and I can make sure you get that invitation. With that, again, we really want to thank our Lieutenant Governor, Mike Kehoe, for all the information he provided and leadership that he's showing for our state and support, as well as Jennifer Hagan-dier with NIST MEP, the National Network. Thank you. Michelle Hataway, everything that you're doing, working on the clock, really, you and your team, and Ann Pardalis with International Unit there at DED. Rob Dixon, the director there. Thank you to Dave Goebel on our team. Thanks to SEMA Director Kylie Dicknight, SEMA, I think I already mentioned them, all the other legislative offices and Department of Health and Senior Services. Again, we will get through this together. If you have other questions that you're gun shy and didn't want to ask today, or you think later on, just go ahead and send that to myself or to Dave Goebel. So, have a great day and please stay safe out there. Thank you.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
Bye.
Thank you. Bye-bye.
Bye.